Hello, and thank you for contacting Wave Support. I see from your clinical request that you have a very complicated advanced keratoconus patient that you're working with. It sounds like you're very close to achieving a successful fit. And a couple of thoughts, as you know, with these keratoconus patients, all the rules go out the window. And the same thing with Wave with keratoconus to some degree. As you know, we have a very nice looking topography, but my general impression usually is with these really high keratoconus patients who get some nice data centrally here. But a lot of this blue area, I think we lose some data just from the limitations of the just of getting the topography. So sometimes we have to really rely on our clinical impression of how this lens is sitting more in the peripheral areas to see how well we're really doing with this fit. If we look at your design, I actually like your design based on all the things that we usually do. This is a very nicely looking fit lens, and I see how you chose to fit more of this, the kind of the two pointed cone here, just sort of concentrating the central part. And if this lens is fitting quite well and we're not doing any damage centrally with this cornea, if you feel you have enough clearance through here, they may just work on peripheral edge issues. One thought is to make sure that the lens isn't too tight out in the peripheral areas. If it's too tight, you could just switch over to tangential design. As you know, that may flatten up the outer peripheral area. You might recall that axial designs tend to fit a little steeper, tangential tend to be a little flatter. Or you might have to use a little, your clinical impression just to sort of manually increase the lift in these outer areas. Another thought you have, another possibility would be, instead of just keeping the OZ the size of the part of the central part of this cone, you could go for a little larger OZ and just try to encompass the entire area. So that would be maybe moving the red dot out closer to maybe 5 or so, and moving the blue out to about 6, maybe 5.5 and 6. That would in essence give you sort of a rounded back surface OZ to try to go around both peaks there on that keratoconus. I personally probably would take a little different approach than that. I would probably look at maybe using this Aspheric Design if you haven't used it yet, the S factor on this patient. And if you look at your design, I pulled it up here once again. And if we look at this back surface here, you'll notice that if we look at the meridians here, we have you'll look at this vertical meridian from the inferior quadrant. If you look right here, you'll come across, you get this kind of a dip here. And if you hang out for a second, I'm going to pause the video while I bring up another design. Okay, welcome back. And so on the left-hand side here, you have your original design, and you'll see how this back surface kind of sort of comes kind of flat and then kind of drops off through here. And you'll see if I switch over to this, throw a little aspheric design in here, a little back surface asphericity, just putting a little bit in using that S design there. And you'll see right away you get a little bit more of a smoother transition. If you kind of follow that lens around, you'll see it kind of does the same thing all around there. Kind of look at this meridian here. You get a little smoothing effect, especially in that vertical meridian here. You'll see it just kind of smooths off a little bit more. You'll also notice that if you look at that meridian, you also get a little more steepening here. And so I think you get a little more clearance in this central cone area if you go aspheric on this. So that's another way to get a lens to kind of more slow transition here. There's not one set rule that'll work better than another. I think you might have to do a little trial and error with these patients. But once again, it sounds like you're pretty close. If you got a lens that's able to be worn that long in the daytime, I would just concentrate more on making sure you have enough edge clearance to make sure it's not a tear exchange issue. Another alternative, I guess, if you find yourself backed into corner, a lot of docs sometimes find going to a mini scleral design can be helpful. Unfortunately, some of these really high protrusions on these keratoconus patients, you almost have to get a full scleral design. And either you could use the tool under here for Wave using the semi-scleral large diameter lens tool at the bottom, or better off, you might be better off using the OCT fitting set that Wave has available. So, but it sounds like you're pretty close in your current design. So again, I would try a couple of things there. Maybe go to the aspheric back surface and then look at the peripheral edge part of this lens, see if you have to work on edge clearance to make sure you have enough tear exchange underneath the lens, and I think that'll hopefully get you right back on track. So it sounds like you're close on this design. I wish you well, and thank you for contacting New Wave Support.